A student produced this for UND's TV show, Studio One.
Health services can be taken for granted by those living in cities. But when you live an hour away from the nearest hospital, emergency care can be seen as a luxury. Director of the Rural Information Hub, Kristine Sande, is here to explain what resources the center has to offer those living in remote communities. Thanks for joining us today, Kristine.
Oh, you're welcome. I'm glad to be here.
Do you want to first start by explaining what is the Rural Information Hub?
The Rural Health Information Hub actually right now is called the Rural Assistance Center, but as of December 1st, we will be the Rural Health Information Hub. So we're excited about that change. And we are in a national information service for rural health. We're funded by the Federal Office of Rural Health Policy. We get $2.1 million a year to provide this information service to people across the whole United States. So, you know, we deal with people in Georgia and Washington, D.C., and it's a great opportunity for us here at UND to be leaders in rural health information. And we're located within the Center for Rural Health over at the medical school. And obviously take advantage of all the expertise up and down the hallways of the Center for Rural Health.
All right. So how does one know if they're rural or not?
That's a tricky question. There's actually dozens or maybe hundreds of different definitions of rural. So one that's often used is whether you are in a town over 50,000, that would be considered urban, and otherwise you would be considered rural. And that's really the most cut and dry definition, so probably the easiest to use, but there are many other definitions, which is kind of, seems crazy, but I think a lot of different federal programs are designed and have things that they're trying to achieve, so they create a definition for what they mean by rural, and so that's kind of how it got so complicated.
Okay, so how are you guys able to serve the whole country from one location?
Well, we rely heavily on technology. So our primary service is our website. We have a very comprehensive website of rural health information that's updated on a daily basis. We have people who are out looking for new information every day. You know, looking for funding opportunities, for news about rural health, for new research and new regulations, and updating our website with that so people have easy access to it across the whole nation. You know, and when we started doing this service back in 2002, we had a lot more people contact us by phone or by email looking for information, and now people really are relying on the website more and more all the time. And so, you know, our job is to really make sure we have our finger on the pulse of what's going on in rural health and rural communities, so that we can provide the information those communities need in an easy to access manner.
Okay, so what type of services do you guys offer then?
I mentioned our website where people can find all of those different types of resources, as well as some other tools like Am I Rural? People can see if their location is rural based on various definitions. We also have a community health gateway that has evidence-based toolkits, as well as rural health models and innovations. So things that have been tried in rural communities, and you know, sharing that information amongst, you know, communities all across the nation, so that they can learn from what other communities have tried rather than recreating that wheel all of the time.
Okay, so what is personally your favorite part of your job then?
I think my favorite part of the job is that I get to live in North Dakota and yet serve the whole nation, which for me is a big perk. But I also really love hearing about how we're making a difference. You know, when we go to a conference or meet people who use our service, you know, they tell us how heavily they rely on it and what a difference it makes, you know, when they're in a rural community wearing, you know, 4 different hats, and, you know, if they can have something that helps them find that information quickly, it really helps.
All right. So lastly, what would you guys like to accomplish long-term with the center?
You know, I think mainly our goal is to just make sure that we keep up with the needs of rural communities and continue to evolve and help them as they need it. So.
All right. Well, thanks for joining us today, Kristine.
You're welcome. Thanks for having me.